Welcome to Managing CML. My name is Karen Seiter, and I'm Professor of Medicine at New York Medical College and Director of the Leukemia Service at Westchester Medical Center. I'm frequently asked, how do we recognize treatment failure or treatment resistant? A patient is considered to have treatment resistant when they either fail to meet expected treatment milestones or where they show evidence of loss of a previous response. Failure to meet milestones is known as primary failure. Two organizations, the National Comprehensive Cancer Network, or NCCN, and the European Leukemia Net, or ELN, have created easy-to-follow guidelines for the treatment of patients with CML. Although there is considerable overlap between the two sets of guidelines, there are also some notable differences. Both groups recommend a comprehensive bone marrow evaluation at diagnosis to properly stage the patient. Once treatment has started, a peripheral blood PCR test should be sent every 3 months. Many consider the PCR reading after 3 months of therapy to be the most important treatment milestone. Both groups agree that a patient should ideally have a PCR reading of less than or equal to 10% at the 3-month time point, or a partial cytogenetic response if a PCR cannot be obtained. The ELN further specifies that a patient with a complete hematologic response, but with a higher PCR reading, is considered a warning, whereas a patient who has not achieved a complete hematologic remission after 3 months of therapy is considered a treatment failure. The two groups differ somewhat at the next time point, the 6-month PCR. Here, the NCCN again recommends that the PCR be less than or equal to 10%. However, the ELN recommends that the PCR is optimally less than or equal to 1%. A reading of 1 to 10% is considered a warning, whereas a PCR of greater than 10% at 6 months is a treatment failure. The patient should be again monitored at 9 months, but the next formal milestone is at 12 months. Here, the NCCN considers achievement of a complete cytogenetic response to be the recommended level of response. The ELN guidelines are more stringent and consider a major molecular response, meaning a PCR of less than or equal to 0.1%, to be the optimal response, with a PCR of 0.1 to 1% to be a warning, and a PCR of greater than 1% to be a treatment failure. After 12 months, the ELN recommends that the patient be in major molecular response or better. The NCCN recommends continuing the current therapy as long as the patient has a complete cytogenetic response. Secondary resistance is demonstrated when a patient who has previously responded to therapy starts to lose their response. This is most often noticed as a rise in the PCR value. An increase of more than a log is considered of concern, especially if the patient loses MMR. Of even more concern is the loss of complete cytogenetic response, and especially of loss of complete hematologic remission. Thank you for viewing this activity. For additional resources, please view the other educational activities on managingcml.com.